Today is October 24th, 2016. My name is Billy Fuller, and I will be doing an oral facial exam on Miss Nicole Mech, and I will be the therapist, and she will be the examinee. All right, let's get started. Hey, good afternoon, Miss Mech. How are you doing?
Good. How are you?
I'm well. Today we're going to do an oral facial examination. It's going to check your structures of your mouth to make sure everything's working properly. So we're going to get started. But first, can you sign this consent form here to make sure we're going to be okay to do everything? And I am going to wipe down my workstation just to make sure it's nice and clean here. No germs or contamination. And for your safety and for my safety, I'm going to wash my hands, or I'm hand sanitizing, and I'm going to put on my gloves just so we can begin the examination, okay?
Okay.
All right. And how are you doing today?
I'm doing well.
Okay.
How are you?
I'm well. I've just been seeing a lot of clients today, so get that. Okay, so first we're going to start with, I'm going to check the symmetry of your face to make sure everything's nice and even, okay?
Okay.
So, all right, everything's looking nice and even. Got good symmetry here. All right. Yeah, breathing out through your nose, so no mouth breathing, no abnormal movement, so we're good to go.
Okay.
All right, we're going to check the evaluation of your jaw. Okay, so if you can you please move your jaw to your left and your right, please? Okay, all right. And let's see, there's no deviation to the left or to the right. All right, and we're going to check your jaw for any TMJ. Can you open it real slow for me? All right, can you close it? All right, great job. Thank you.
Mm-hmm.
All right, and now I'm going to grab my tongue depressor.
Okay.
And we're going to check your teeth and see if you got any occlusion or if it's going to have an overbite or an underbite. So can you smile for me, please? Good to go. Can you open up? All right, you got all your teeth. Okay, we're good to go. All right, I'm going to throw this one away. All right. All right, can you say ooh? We're going to check your lips. Can you say ooh? Okay, it's good. Good. All right, and you got nice symmetry. No drooling, no cracking your lips. Okay. And can you see your ooh one more time and hold it? Now, can you press out against this? Okay, good. Little strength. Don't let me push you back. All right, good job. All right. So now, can you say E for me?
E.
Okay. Motion. And you got good symmetry again. Can you say ooh, E, ooh, E?
Ooh, E, ooh, E.
Good job, good job. Okay. All right, now, can you puff out your cheeks for me and hold the air? All right, good job. I'm going to stick my finger under your nose to make sure you, okay. All right, no nasal emission. Good, you let go. Thank you.
Okay.
All right. All right, now we're going to check your tongue. Can you open up and let me see? Just open up, see up. Okay, you got nice normal color, no movement. Okay. All right. So, now we're going to check. Can you just stick your tongue out and then, no, don't rest on your lips, just stick it straight out. All right, can you lift it up, please? Let me check your frenum. Okay. All right, you got a little short frenum. Okay. All right. All right. That's normal, and your tongue size is normal. All right. Now, can you protrude it one more time?
Mm-hmm.
All right. All right. Can you now? We're going to. I'm gonna ask you to press it onto the side. Don't let me press it. Okay. There we go. Now to your. All right. And then can you stick forward, and now we're gonna push it. Okay. Great job. That's great tongue strength. All right. Now, can you we're gonna test. We're gonna get your posterior and your anterior motion. Can you say the word la for me?
La.
Can you say ka?
Ka.
Can you say la ka, la ka?
La ka, la ka.
All right, great job. All right. All right, now can you stick your tongue out one more time?
Mm-hmm.
Can you stick it? Stick your tip. Okay, great job. Now stick your tongue tip down. Great job, great job. Thank you.
Mm-hmm.
All right, and now we're going to, the fun part, we're just going to do a little rapid movement. From side to side. That's best she can. All right, great job, great job. All right. All right, now we're going to examine the inside of your mouth or your pharynx so we can see if you got anything abnormal in it. Okay, can you open up and say ah? All right, that's good. Normal color right there. All right. Thank you for that. All right. And your tonsils are there. All right. All right, now I'm going to check your hard palate and your soft palate just to make sure everything is going to be normal and your color is going to be normal. Can you open up one more time for me? Okay. All right. Your arch is a little high in your palate, but that's okay. All right, can you stick your tongue down for me? Okay. All right, tongue. Your uvula's in the right place. All right. Great color. Great color. Thank you. And you don't have any growths or anything, so we seen that you're pretty normal there, but you do have a kind of high arch, but that's still normal for people. Okay. All right. Okay, now I'm going to test for your gag reflex. So I'm just going to place this tongue to pressure on the middle of your tongue to make sure your gag reflex is going to be normal.
Okay.
All right, can you open up for me? All right. Long gag reflex. All right. Now, can we get a big ah for me one more time?
Ah.
All righty, so now let's see one more time. I'm sorry, we didn't have my flashlight on. Ah. All right, yeah, the uvula's in the right place and your tonsils there. Great job. All right. All right. That's normal. All right. Now we're going to do one more part of the oral facial exam test, and it's going to be it's going to test your speech rate. So we're going to have a little fun, get you to say a couple of words here, okay?
Okay.
All right. I'm going to throw off these gloves because I'm going to touch my phone just to get you ready to go. All righty. Yeah. So I guess my phone's down for a little second, but it's okay. That's the trouble with these electronics here. All right, you ready? So what I'm going to have you do is I'm going to have you say "pa" first, and we're going to do those for 20 repetitions. Okay?
Okay.
So you're going to say them as fast as you can, and for 20 repetitions, and I'm going to have you stop. Okay?
Okay.
So are you ready to start?
Ready.
All right, start.
Stop.
Stop. All right. Now what I'm going to have you say next time is "ta."
Okay.
And you're going to do 20 repetitions of "ta" up on my start, and then I'm going to tell you to stop when I say, and you stop when I actually stop. Okay.
Okay.
All right. Let's start. Stop. Okay. And the last one I'm going to have you say is "ka."
Okay.
And we're going to do it again for 20 repetitions, and when I say stop, you stop. Okay.
Okay.
Let's start. Stop. All right. And now we're going to put them all together. Pa, ta, ka. And again, it's going to be for 20. This is going to be for 10 repetitions. I'm sorry.
Okay.
And when I say stop, we can stop. Okay?
Okay.
You ready?
Uh-huh.
All right, go. Stop. All right. I appreciate it. And that concludes our oral facial exam. Thank you, Miss Mac.
Thank you.
Mm-hmm. We're going to test your speech rate today. And so what I'm going to have you do is I'm going to have you say 3 separate syllables, and then I'm going to have you say them all together, okay?
Okay.
So what we're going to do, I'm going to have you say the word "pa" 20 times, and when I say stop, you just go ahead and stop, okay?
Mm-hmm.
So are you ready?
Yes.
All right, let's start. Stop. Okay. That was real good. Thank you for that.
Mm-hmm.
All right. Now, our next syllable is going to be "ta," okay? And we're going to say that 20 times, and when I say stop, just go ahead and stop.
Okay.
And start. Stop. Okay. Great job. Thank you for that one. And the next one is "ka." And you're going to say that 20 times and stop when I say stop.
Okay.
Okay. Start. Okay. Stop. Great job. That's a great job. And now we're going to put them all together. It's going to be "pa, ta, ka," but this time it's going to be 10 reps. Okay.
Okay.
All right. Let's start. Stop. Great job. All righty. Thank you, Miss Mac.
Thank you.
And that concludes our oral facial examination. Today, Miss Mac, she had 3 different distinct problems. She had TMJ, which she had popping in her jaw. Her second one is that she had a short frenum, and that we also found that out. And she also had a high palatal arch. And that will conclude the examination in her 3 areas. Today is October 24th, 2016. I'll be the therapist. My name is Billy Fuller, and Miss Daria Borowski is going to be, she's going to be the client, so we'll be evaluating her. All right, good afternoon, Miss Daria. How are you doing?
Good, how are you?
I'm doing well. We're going to do an oral facial exam today. We're just checking all your structures of your mouth to make sure everything's okay, all right? All right, and here is our consent form. If you can sign that for me, please, to make sure we're going to be okay to do this. And I'm going to wipe down my countertop here, make sure everything's nice and clean. All right, and for your safety and for my safety, I will be washing my hands and putting on my gloves. Because we don't want to transfer anything. Are you doing okay today?
I am.
Okay. It's been a busy day.
Yeah.
Gloves always give me trouble. They should find something easier for us to put on. All right, we're going to get started. We're going to get started by, I'm just going to take a look at your face to make sure everything is straight and everything's in the right symmetrical order. So, okay, you got a nice, round, straight face. All right. All right, no mouth breathing. All right, breathing through our nose. Let me get that. All right, that's normal. That's none. And that's yes. All right, now we're going to check the range of motion in your jaw and your teeth. Can you open up and move your jaw to the left and to the right? All righty. Okay. All right. Now let me check the symmetry. Okay. Let me see. Oh, you're deviating to the right a little bit. All righty. We're going to notice that one. And can you open up real slow for me? All right. Open it one more time. Okay. No popping or anything. But we do see a little deviation. All right. Now I'm going to grab my tongue depressor. And we're going to have you smile so you can look. All righty. No occlusions. Can you open up for me, please? Make sure we got all our teeth. And we're good to go. All right. All right, I'm going to throw that one in the trash. I got a couple of them here. So we're good. So, yeah, that's normal. Great hygiene. All right. Now, can you pucker your lips and can you say, ooh? Ooh. Oh, great job. All right. It's normal lips, no cracking, no drooling. Can you go ooh and hold it for me and push out on this? Push out, push out, push out. All righty. All right. Don't let me push back. Great job. We're going to throw that one away. So we got normal. All right. It's normal. All right. Now, if you can please just smile for me if I can ever get a page turn. All right. Now, can you smile for me? Can you say E?
E.
Great job. Can you say ooh, E, ooh, E?
Ooh, E, ooh, E.
All right. Everything's normal right there. All right, now, can you puff your cheeks out? I just need to go puff it out and hold it for me. All right, you got a little, okay, it's a little. And now, can you let it go? All right, it's no nasal emission. Can you do that one more time for me? Okay, you do. Okay, thank you. You can let that, thank you for that. And you do have reduced lip strength, but no nasal emission. All right, now we're going to evaluate your tongue. So I'm going to grab my pen light and we're going to take a look at it. Now, can you stick out your tongue? Don't rest it on your lips. Stick it out. All right. Normal color. All right. No, it's a little bit of movement, but it's okay. All right. Then you have a normal sized tongue. And we're going to check your freedom. I'm going to cut my light on one more time just to make sure I see. Can you open up and go? All righty. All right. It's nice. Okay. All right. So that's normal. All right. Now, can you stick out your tongue again and protrude it? Don't press it out. Okay. All right. No deviation to the left, to the right. All right. Normal. All right. Now, can you stick your tongue out and in real fast? All right. Good job. All right. Now, if you can stick it out and press it to the right for me. All right. Don't let me push back. All right. Thanks. All right. That's normal. And I'm going to ask you to do the same thing, and we're going to go left. All right. Can you stick it to the left, please? Let me push up. All right. All right. Great job. We're going to throw that one away. All right. That's normal, and that's normal. All right. Now, can you stick out your tongue and move your tongue tip up? All right. And stick out and tongue tip down. All right, great job. And one more time, I'm just gonna press. You're gonna stick your tongue out, and I'm gonna press the tongue blade against it. Don't let me push it in. Don't let me push it. Okay, great job. All right, that is the end of my tongue depressors. So, all right. All right, now we're just going to examine your pharynx, and that's just going to be the inside of your mouth to make sure I don't see anything abnormal in there. Can you open up for me, please? All right, that's good coloring. All right, it's very normal. It's very normal. Normal arch, no growth. You don't have anything growing abnormal on there, so I don't see anything, no clefting, so you don't have any holes in your palate.
Yes.
All right. Now, I am going to grab one more of my tongue depressors here. I'm sorry. Let's grab one out of my bag so we can test your gag reflex. Now, I'm not going to stick it all the way in your mouth, but I'm just going to touch on the middle of your mouth just to make sure the gag reflex is okay. Can you open up for me, please? All right. That's a great normal gag reflex. And the next thing, I'm going to ask you to say ah so I can check your tonsils. So you give me a good ah.
Ah.
All right. Open up a little bit more. Put your tongue down. Okay. Got your tonsils and your uvula. Okay, straight. All righty. And everything seems normal. All right, but you did have a little bit of deviation in your jaw, and it deviated to the right. That's what I did see. And you did have a little when I asked you to pucker your lips, you did have a little air coming out of it. So we're going to refer you in and see if we can get that taken care of. Just because I'm a little concerned about it. But you should be okay. All right. And so our last part of our oral facial exam is going to be a speech rate exam. And what I'm going to do is I'm actually going to you're going to actually say 3 syllables, and we're going to time it for you. And throw off these gloves. We're going to time it to see, what's the rate of speech that you have. All right. So I got my handy dandy phone. So just give me 1 second. All right. So our first syllable we're going to say is puh. Okay, I'm going to ask you to say it 20 times, and when I say stop, you stop. And you're going to start when I actually start. So, start. Okay, stop. All right. That's a great job. Thank you for that. And the next one is going to be tuh. So I'm going to actually say 20 times again, and when I say stop, you stop. Okay, start. Stop. All right, great job. And the next one is going to be cuh. Okay. Start. Stop. All right. And now we're going to put them all together. You're going to say puh, tuh, cuh, but it's only going to be 10 times this time, okay? All right, start. Stop. Okay. Great job. All righty. That concludes our oral facial examination, and I appreciate it. Thank you, Ms. Derry. Have a nice day.
You too.
All right.
So I'm Nicole Mech, and I'm going to be the examiner today for our oral mechanism examination on Daria Borowski, who's our examinee. Today's October 24th, 2016. How are you, Daria?
I'm good. How are you?
Good. So the first thing I'd like for you to do is go ahead and sign this consent form for me. This just gives me permission to go ahead and examine you. And while you're doing that, I'm going to go ahead and sterilize our workstation. And go ahead and put some hand sanitizer on, just so we're not passing germs back and forth. Is there anything specific that brings you in today, or just?
Nope. Just here to get everything checked out.
Okay. Alright, so the first thing I'd like to do while I'm getting my glove on here is just take a look at your face. Okay. Sorry.
It's okay.
Jeez Louise.
Sticky.
There we go. Alright, so go ahead and just look straight at me. I'm going to check for the symmetry and the shape of your face, make sure everything looks normal, and it does. And I notice you're not breathing out of your mouth, you're breathing out of your nose, which is good. Okay. All right, go ahead and open up your jaw for me. Open up your mouth and just go up and down and side to side. Good. Does it move a little bit to the right? When that, I kind of noticed it moves to the right a little bit. Okay. All right, and I didn't notice any popping or grinding. Do you notice any popping or grinding?
No.
Okay. All right. So the next thing I'd like to do is take my tongue depressor, and what I'd like for you to do is I'm going to check your occlusion of your teeth to see if you have normal occlusion. That just means that when you bite down, everything fits in the right spot.
Okay.
So go ahead and smile for me. Okay. Looks good. All right. And go ahead and open up. Let me take a look at your teeth. Okay, everything looks like it's there. All right. All right, now I'm going to check your lips. So the first thing I'd like for you to do is go ooh-ee, ooh-ee.
Ooh-ee, ooh-ee.
Okay, good range of motion. Okay, everything looks symmetrical and even. That's good. All right, now I'm going to take my tongue depressor and I'm going to hold it to each side of your mouth. And when I do that, I want you to stick your tongue out to the side like this and try and push my tongue depressor away.
Okay.
Okay. Good. Other side. Good. And then out front. Very good. All right, go ahead and smile for me. All right. And go ahead and puff out your cheeks. Okay, good. Try that one more time for me. Okay, I notice a little bit of air is escaping through your mouth. Let me do it one more time. I'm just going to check to see if any air is coming out of your nose. No. Okay. Good. Okay. All right, go ahead and stick your tongue out. Okay, and then back in. And then stick it out again and back side to side. Okay, good range of movement on your tongue. It's normal size. Point your tongue up towards your nose. Okay, good. And normal speed, normal strength. We check that. All right. I think we've checked everything with your tongue. Range of motion was normal. Let me check that strength one more time. Okay, I thought so. You have a little bit of limited strength on both sides of your tongue, so I'm going to put reduce for that. I moved your tongue tip up, so that was normal. Range of motion was normal. Tongue tip down was normal. Good, and side to side. All right, so the last thing that I need to check inside your mouth is your hard and soft palate, okay? So what I'm going to have you do is open up your mouth. I'm just going to take a look around first, okay? Okay, looks good. Normal color. Your alveolar ridge looks normal. Did you have your tonsils removed? No? Stick your tongue out for me. Okay. Say ah.
Ah.
Good. Normal uvula. Everything looks good inside. Good. Color was normal. Chin normal. Normal arch. No growths. No clefting. Good. And symmetry looks good. All right. Just put the tongue depressor on your tongue to check your gag reflex. Good. It's normal. All right, and just say ah for me one more time.
Ah.
Good. Just checking to see if your velum or your soft palate was moving when you said that. And it does, so that's good. Okay. All right, so I'm going to throw my tongue depressor out because we're done with that. Take my gloves off. And the last thing I need to check is your speech rate.
Okay.
So for that, I'm going to have you say a couple sounds. My phone here. All right, so the first sound that I need you to make is puh. Can you say puh?
Puh.
Okay. But when I say go, what I'd like for you to do is say puh, say that sound as many times as you can. I'm just going to be looking for 20 times, but I'll tell you when to stop when I need to. Okay? So ready? Go. Excellent. Stop. Good. Okay. The next sound I need you to make is tuh. Same thing. You're going to say tuh as many times as you can. Repeat it as fast as you can. Okay? Ready? Good. Stop. Okay, and the last sound is ka. Say ka. Ka. Good. All right. Ready? Go. Good. Excellent. So now the last thing, and this is only for 10 times, but we're going to say all three sounds together. Pataka. Can you do that for me?
Pataka.
Good. Just as fast as you can. And go.
Pataka, 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 pataka.
Good. Stop. Okay. Excellent. All right, so that's it for the oral mechanism exam. Like I said before, I did notice some deviation of your tongue while we were doing the exam, and there was also some slight air emission from your lips when I asked you to pucker, and let's see, a little bit of reduced strength with your tongue blade. But we'll get all that checked out and let you know what we find, okay?
All right, thank
All
you.
right.
Hi, my name is Daria Borowski, and I'm going to be the clinician doing an oral mechanism exam on Nicole Mech. Hi, Nicole, how are you?
Good, Daria. How are you?
I'm good. So today I'm going to be doing an oral mechanism exam. So I'm going to be looking at the functions and structure of your face, inside your mouth, and taking a look.
Okay.
So first, if you could sign this consent form for me, just stating that you're giving me permission to look inside your mouth. All right, thank you.
Mm-hmm.
I'm going to go ahead and wipe down our area, make sure everything's nice and clean and sterile. And put some hand sanitizer on. And I'm going to put on a glove since I'm going to be touching your face, not to get any germs on you. Alright, so the first thing I'm going to do is take a look at your face and make sure everything is symmetrical. Okay, so look straight at me. Alright, good. Everything looks symmetrical. You're breathing out your nose, not your mouth, and there's no abnormal movements. Perfect. Alright, next I'm going to look at your jaw and your teeth. So can you go ahead and open and close your mouth? Alright, good. Go straight down. Now move it to the right and left. Alright, perfect. So you have normal range of motion. Symmetry is good. And the movement's nice and fluid. Now I'm going to feel your jaw for any popping. Alright, so you do have a little bit of popping going on. Is that something that bothers you normally?
Not really.
Okay. Alright, good. Now I'm going to take a look at your teeth. So I'm going to take a tongue depressor and just take a look at how your teeth are overlapping each other. Smile. Good. Perfect. Everything looks normal. Throw that one away. Alright, so you don't have an overbite or underbite. All looks normal. Alright, go ahead and open your mouth. Make sure all your teeth are there. Good. Alright, your teeth are normal and you have really good hygiene. Perfect. Alright, next what I want you to do is take a look at your lips. So go ahead and puck your lips. Say ooh. Alright, good. Now hold it for me. Alright, perfect. Okay. No air coming out of your mouth, which is good. Your symmetry is good. So now I'm going to take a tongue depressor and I'm going to put it against your lips. Go ahead and make that pucker face again. Okay. And push against. Good. You have very good lip strength. Alright, now I want you to go ahead and smile for me. Alright, good. Good range of motion. Say ooh-ee, ooh-ee. Perfect. Alright, smile one more time. Alright, good. Nothing's drooping, no drooling. Everything looks good. Alright, so now I want you to puff your cheeks and hold air in your mouth. So, alright, good. Okay, there's no nasal emission, which we checked earlier. Alright, and now I'm going to take a look at your tongue. So I'm going to be looking at any movements, the color, everything like that. Okay, go ahead and stick your tongue out. Alright, perfect. Color's good. No abnormal movements. A normal size. Go ahead, take your tongue and put the tip of it to the roof of your mouth. Look under it. Alright, you do have a short frenum. Make note of that. Alright, now I want you to stick your tongue out, just straight. Alright, good. Go straight out, doesn't go to the left or right. And I want you to go in and out, in and out. Alright, good. Your speed, your range of motion is perfect. Alright, go ahead and stick out your tongue. And don't let me push it in. Alright, good. Good strength. Alright, and when you brought it in, that was normal. Your range of motion and speed was good as well. Alright, now I want you to move the tip of your tongue to the right. Okay, and don't let me move it. Alright, good. Other side. Good. Perfect. Alright, we did both sides there. So everything looks normal. Alright, now I want you to do rapid movements, so go side to side. Nice. Very fast. Alright, so now I'm going to take a look inside your mouth again, look at the color of your pharynx, and look at your tonsils. Okay, stick your tongue out. Alright, everything looks good. Good, thank you. Alright, and now I'm going to look at your hard and soft palates. Go ahead, open up again. Alright, the color's good. You do have a quite high arch there, so I'll make note of that, and that's okay. Everything else looks good. No growths, no fistulas, no clefting. Everything looks normal except that arch, but I'll just make note of that. Okay. Alright, and next I'm going to check your gag reflex. I'm just going to put this tongue depressor in the middle of your tongue. Make sure there's nothing going on. Oh, sorry. Good. Alright, and last but not least, I want you to just say, ah. I'm going to go ahead and take a look in there. Alright, good. You have good movement happening in your velum. Everything's symmetrical. You got posterior movement. Your uvula looks good. And no nasality. Alright. Alright, so I'm going to take off my gloves. We're done with that. My pen light away. Alright, the next thing we're going to do is your speech rate. Okay. So we're going to say 3 different sounds, and I'm going to ask you to say them 20 times, and I'm going to time you. Okay. So the first sound is puh. Can you say puh? Puh. Okay, so again, you're going to do that 20 times, and I will tell you when to stop. Okay. Okay, ready? Puh, 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 puh. Alright, stop. Alright, the next sound is tuh. Okay, so tuh. Perfect. And go. Good. Last sound is ka. Okay. Perfect. Quick. The last one is pataka. Okay. Pataka. So it's like pataka, pataka, pataka. Okay. This time it's only 10 times through. All right. And go. Pataka, 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 pataka. And good. Alright, Nicole, we're all through. So just to wrap everything up, for the most part, everything looked good. You did have a high arch. You had some of that TMJ popping, okay. Which we talked about. And you also, I'm going to fix this. Alright, go ahead, stop it.
I'm Nicole Mack, and this is Billy Fuller. I'm going to be conducting an oral mechanism exam today, October 25th, 2016. How are you, Billy?
I'm well, thank you for asking.
Very good. So the first thing I need you to do is go ahead and sign this consent form, and this just allows me to examine you today, okay?
All right.
And while you do that, I'm going to go ahead and Here our station.
Okay.
All right, Billy. So the first thing I need to do is just check the symmetry and the evenness of your face from the outside. So if you could just look at me. Okay, everything looks great. And you're breathing out of your nose, that's good. Okay. All right, go ahead and open up your mouth for me, up and down and side to side. So ah, good. Alright, and I'm just going to feel the sides of your mouth just to see if I feel any popping or grinding. So open up your jaw. Good. Okay. Alright, let me go ahead. I'm going to take my tongue depressor, and what I'd like for you to do is open up and bite down like that so I can see the occlusion of your teeth. Bite down. Good. Good. Normal. Got all your teeth in there. Alright. Good hygiene. Okay. Alright, so the next thing I need you to do is pucker your lips like that. Okay. And then you're going to move them from side to side. Good. Okay. No drooping or drooling. That's good. All right. And then if you could just push your lips just like you did before. Good. Push away from the tongue depressor. Good. Okay. All right. Go ahead and smile for me. Good. Say ooh ee ooh ee.
Ooh ee ooh ee.
Good. All right, go ahead and puff out your cheeks with air and hold it. Don't let any air escape from your lips. Excellent. Good job. Okay. Do it one more time for me. I'm just going to feel under your nose. Okay, no air escaping. Good. All right. Go ahead and stick your tongue out and then back in. Good. And then from side to side. Stick it out from side to side. Good. Okay, good. All right. And take a look inside just to see the color. Good. And then lift up your tongue outside, like towards your nose. Good. Excellent. Thank you. Okay, good range of motion, good speed. All right, the last thing I'm just going to check with your tongue is, again, with the tongue depressor. So I'm going to put the tongue depressor on the side of your lips, and then if you could stick your tongue out and push against the tongue depressor on either side, okay? Good. Excellent, good. And then straight out, push hard. Good. Okay. Excellent. Moving right along. Okay. All right, so what I'm going to do now is look inside your mouth at the back of your throat to check your hard, well, look up top to check your hard and soft palates, and the back of your throat, check your uvula and the color and everything like that, okay? So go ahead and open for me. Good. Did you have your tonsils out? Okay, good. And I notice, look down a little bit for me. Okay, and go ah. Good, okay. I notice your uvula, that's a little piece of skin that hangs down in the back of your throat, kind of deviates a little bit to the right. So I'm just going to make a note of that for you, okay?
Okay.
Okay. let me look at one more thing. The ridges on the top of your hard palate. Excellent. Thank you.
Mm-hmm.
There's no clefting, no growths. All right, and I did notice a little bit of discoloration on your palate or inside your mouth, so I might make a referral about that just to get that checked out, okay?
Okay.
All right, and then the last thing, let me just check your gag reflex and see. I'm just going to push this on your tongue, okay? Good. All right. Okay, perfect. All right, so that's it for looking in your mouth. The next thing we need to do is just check some of your speech rate, okay? And to do that, I'm going to use an app on my phone, okay?
Okay.
All right. There we go. Okay. All right, so the first thing I need you to do is say the word puh.
Puh.
Okay, so when I say go, you're going to say puh as many times as you can.
Okay.
I only need 20, but I'll tell you when to stop, okay?
Okay.
All right, so practice real quick. Puh, puh, puh.
Puh, 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 puh.
Perfect. Okay, ready, go. Excellent. Good, stop. All right, now this time we're going to do tuh. Say tuh.
Tuh.
Good. Tuh, 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 tuh.
Tuh, 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 tuh.
Perfect. All right, ready, go. And stop. Good. And the last one is cuh. Say cuh.
Cuh.
Cuh, 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 cuh.
Cuh, 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 cuh.
Good. Got it?
Okay.
All right. And go. Perfect. Excellent.
Had a little slip up there.
Yeah, it's tricky. Guess what I'm going to ask you to do now? Say them all together.
Okay.
But I only need 10 this time, so hopefully it'll be a little shorter, okay? So, pataka, practice that.
Pataka.
Good. All right. Ready, go.
Pataka, 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 pataka.
Good. Stop. All right.
Hi, my name is Daria Borowski, and I'm going to be the clinician today doing an oral mechanism exam on Billy Fuller. And today is October 25th, 2016. Hey, Billy, how are you?
I'm well.
Good. Before we get started, I want you to sign this consent form, just giving me permission to do an oral mechanism exam on you.
Okay.
And while you do that, I'm going to clean off our work area and sanitize my hands. All right. Can I just get that pen back, please? Thank you.
Mm-hmm.
All right, the first thing I'm going to do is just take a look at your face for symmetry, make sure everything's even on both sides. Just take a look at me. All right, everything looks good. There's no abnormal movements, and you're breathing through your nose. You're not using your mouth to breathe. Looks good. All right, next I just want you to open and close your mouth. All right, good. You have good range of motion. Do it one more time for me and leave it open. All right, go straight down. It's very symmetrical. There's no jerky movements. Now I'm going to feel and just see if there's any popping. All right, close, open. All right, you do have some popping there, so I'm just going to make note of that.
Okay.
Okay. Good. All right, next I'm going to take a tongue depressor and I'm going to look at your teeth, make sure everything's aligned.
Okay.
Go ahead, bite down. Bite. All right. Looks good there. Normal. All right, go ahead and say ah. All right, looks like you're missing some of your back molars. Have you gotten any teeth pulled?
Yeah, I did.
Okay. So some teeth are missing in the back. Okay, but overall it's normal. You have good hygiene. All right, and next I want you to pucker your lips. Go. All right, perfect. Symmetrical, normal. Go ahead and push against. Perfect. All right, now I want you to smile. Say ooh-ee, ooh-ee.
Ooh-ee, ooh-ee.
Okay, you have good range of motion there. Symmetrical. Alright, now go ahead and puff your cheeks and hold the air. Alright, good. One more time. Alright, good. Good lip strength. There's no nasal emission. That's perfect. Alright, and next I'm going to take a look at your tongue. So go ahead and stick your tongue out. Alright, a little bit further. Perfect. Alright, so there is some discoloration on your tongue. I'm just going to make note of that and see if we notice anything else along the way. But it has some normal movements, normal size. Everything else looks good. I want you to stick out your tongue and then raise it to the top of your mouth. Good. Alright, now I want you to stick out your tongue, go left and right. Alright, up and down. In and out. Perfect. Okay, now I'm going to put the tongue to pressure. I want you to push against it with your tongue. Good, other side. Perfect. Alright, everything looks good there. Side to side, good. Alright, now I'm going to take another look in your mouth, look at your pharynx and your tonsils. Alright, good. Tonsils there, pharynx looks good. Alright, and now I'm going to look at your hard and soft palates, look at the colors. Good. See your alveolar ridge, everything looks perfect in there. You have no growths, no fistulas, no clefting. Everything looks normal. Alright, and next I'm going to check your gag reflex. So I'm just going to put the tongue depressor in the middle of your tongue. Alright, good. And last but not least, I just want you to say, ah. Alright, good. Good symmetry. You can see your uvula looks normal. No nasality. Alright, perfect. So we are done opening your mouth. The next thing we're going to do is some syllable rates. So I'm going to use an app on my phone, and I'm going to record how long it takes you to say certain sounds. Our first sound is P, and you're going to do it 20 times, but I'll just tell you when to stop. Say P.
P.
P, 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 P.
P, 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 P.
All right, perfect. Ready? And go. And stop. Good. The next one is T.
T.
T, 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 T.
T, 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 T.
Good. And go.
T, 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 T.
And stop. Same exact one. Good. And K.
K.
Ready, and go. Good. And I want you to put it all together. You say patika, 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 patika.
Okay.
This time it's only 10 repetitions.
Okay.
And go.
Patika, 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 patika.
Good. All right, Billy, and that is it. Thank you so much.
You're welcome.